Today's ICD-10 quick coding tip focuses on understanding how instructional notes for sequencing are applied. My name is Claire and I'm an inpatient coding auditor. In my coding tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. In ICD-10, there are certain conditions that have both an underlying cause and resulting manifestations that occur in different parts of the body. For these conditions, ICD-10 has coding rules, which are called coding conventions, that tell us that we should code the underlying condition first, followed by the manifestation code. This is indicated by a use additional code instructional note at the etiology code and a code first instructional note at the manifestation code. These notes give us instructions on the correct order to put the codes, with the etiology code coming before the manifestation code. Most of the time, the manifestation codes will include the phrase, "in diseases classified elsewhere" in their code title. These codes that are titled "in diseases classified elsewhere" are part of the etiology manifestation rule and should never be used as the principal diagnosis code. Instead, they should be used as an additional code along with the code for the underlying condition, which should be sequenced first. In addition to the instructional notes in the tabular list, these conditions also have a specific structure in the alphabetic index. Both the etiology code and the manifestation codes are listed together, with the etiology code listed first and the manifestation codes are in brackets. The code in brackets should always be sequenced second. Now let's take a look at an example to better understand the etiology manifestation coding convention. If we have a diagnosis of Parkinson's disease with dementia, when we look in the alphabetic index, we will find code G20 listed first, followed by code F0280 in brackets. Code G20 represents the underlying cause, which is Parkinson's disease, and it should be sequenced first. Code F0280 represents that dementia is a manifestation of Parkinson's disease and should be sequenced second. Sometimes there can be codes for manifestations of another underlying condition without the code title including the phrase "in diseases classified elsewhere." In these cases, there will be an instructional note at the etiology code telling you to use an additional code for the manifestation, and another instructional note will be found at the manifestation code telling you to code the underlying condition first. These conditions follow the etiology manifestation coding convention, and the sequencing rules apply. Let's use pneumonia caused by COVID as an example. When you look up U071 COVID-19 in the tabular, there's a note telling you to use an additional code to identify pneumonia or other manifestations. Then when you look at J1282, pneumonia due to coronavirus disease, there's a note telling you to code COVID-19 first. Although the pneumonia is not specifically titled as a condition classified elsewhere code, it's still considered a manifestation of COVID. Therefore, the rule of sequencing the underlying cause and resulting manifestation still applies. Code first and use additional code notes are also used as sequencing rules in the classification for certain codes that are not part of an etiology manifestation combination. This is because there are some single conditions that require more than one code to fully capture the clinical picture. In other cases, adding a secondary code helps provide a complete description of the condition. For these conditions, you'll find in the tabular list either the use additional code instructional note or the code first instructional note, and the sequencing rule is the same as the etiology manifestation pair. This means that the code for the condition with the use additional code note always comes before the code for the condition with the code first note. It's important to know that when specific conditions are in these instructional notes, the note only applies when the conditions mentioned in the note are present. If the listed condition is not present, then the use additional code note or the code first note doesn't apply. Let's take a look at some examples. First, let's look at a condition that has a use additional code note. If we refer to the tabular at code N390 for urinary tract infection, we can see that there's an instructional note telling us to use an additional code from category B95 to B97 to identify the infectious agent. This means that if the physician specifies the organism causing the UTI, you should sign a code to capture it. For instance, if the diagnosis is UTI due to E. coli, you would first use a code for N390 for the UTI, and then assign B962 for E. coli as the cause of diseases classified elsewhere as an additional code. However, if the causal organism isn't specified, the instructional note is not applicable, and you would simply use code N390 for the urinary tract infection. Now let's look at an example of a condition that has a code first note. When coding a pressure ulcer, you'll notice in the tabular that category L89 for pressure ulcer has an instructional note telling you to code any associated gangrene first. So if the patient has a gangrenous pressure ulcer, you must assign and sequence the code for the gangrene before the code for the pressure ulcer itself. However, if the patient is diagnosed with a pressure ulcer and there's no mention of gangrene, then the code first note is not applicable and you simply assign the code for the pressure ulcer. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you'd like me to cover in the future, just leave a comment below and I'll add them to my list. Thank you for watching, and until next time, happy coding.